So we should expect a pretty nice size ingrown when we take it out. Okay, so that's pretty much loose. We've worked our way around. Now we come back in with the other side, which is a skinnier side, and we're going to elevate the underside of the nail. Perfect. So we're all the way down. We've loosened everything. So now we come in with our other tool. We call this a nail splitter or English anvil. It's got a flat surface and a cutting edge. So the cutting edge goes on top of the nail, and then you're going to hear click. You do 1, then 2, and then finally all the way down 3. So once you're all the way down, your nail's lifted and cut, you come in with your hemostat, and you're going to slide this all the way down. And this is the part that's pretty satisfying. You're going to turn, and the nail should come off. So there you go. You can see that was the ingrown that was in there. And as I thought, the base was much wider, and that's what was causing her pain, was this area right here. So very good. So now we check to make sure everything is out. So we're just looking inside. At this time, I'll usually come back in with the hemostat and kind of dissect it out a little bit to make sure that it's nice and clean and there's no more nail in there. I'll usually come in with a different tool. This is called a curette or a dermal curette. And I use this to kind of scoop out anything that could be left inside that corner. This also serves another purpose, and that's to kind of roughen up the root of the nail. We call that the germinal matrix. And what that does is it kind of exposes the cells so that when we apply our chemical, our acid, our phenol, it takes very well. So it just helps with kind of killing the root. So now we're ready for our phenol. And we have this new product, which is very easy to use. Before we had to use the old school bottle, but now we have these kind of handy dandy little sticks that come with their own little phenol vial. So you plunge them down, you break the vial, and they're ready to go. So no mess. So now we're gonna put the acid directly down into the root. You wanna make sure that when you're turning the stick, you're actually turning towards the nail. And what that does is it prevents any of the acid from getting underneath the nail, which would damage the healthy part of the nail, which we want to keep intact. So I'm looking at my watch as this is going on. We're doing 30-second applications, and we do 3 of them. So again, we plunge it down, we come in, looking at our watch, approximately 30 seconds. So we're coming in, making sure that we're all the way down to the root. And then our last application. Coming in. And again, approximately 30 seconds. We're looking at the watch, making sure we're all the way down. And that should do it. So once your phenol has been applied, now we're coming in with our isopropyl alcohol, 70%, or just rubbing alcohol. And we're irrigating or washing out all of the phenol. And this serves 2 purposes. It mechanically gets rid of all the phenol that's in the area, but it also neutralizes the phenol, so it stops it from working. So once you do the 3 applications, that's it. You want to make sure that you stop any further chemical degradation of those cells. So I usually like to do about 10 seconds of the rubbing alcohol. You can see we've kind of let it pool in that corner, and now we clean it off. And there you have it. So once this heals, you'll see that the nail is going to look normal. Once that border heals up completely, the nail has a normal appearance, and that's it. We're ready to go.